Hey everyone, welcome back to the channel. Today we're discussing something incredibly important, the early signs of breast cancer. Early detection is key, so knowing what to look for could make a huge difference. Let's go over the signs and symptoms you should be aware of. Breast cancer is one of the most common cancers among women, but it can affect men as well. While not all symptoms mean you have cancer, it's important to pay attention to any changes in your body. Early detection can lead to more effective treatments, which is why we want to make sure you're aware of the signs. Number 1. The most common sign of breast cancer is a new lump in the breast or underarms. While many lumps are benign, meaning non-cancerous, it's always a good idea to get any new lump checked by your doctor. It may be hard to distinguish between a harmless lump and one that's cancerous, so don't wait if you notice something unusual. Number 2. Another sign to watch for is any change in the size, shape, or appearance of your breast. If one breast suddenly becomes noticeably larger or changes shape, it could be a red flag. Pay attention to any skin changes too, like dimpling or puckering of the skin, which may look like the skin of an orange. Number 3. Pain isn't usually the first sign of breast cancer, but if you experience unexplained pain in the breast or the nipple, it could be an indication that something's wrong. Cancer-related pain is often persistent and doesn't go away with over-the-counter pain relief. If the pain is localized to one spot, like the nipple, and doesn't improve, make sure to talk to your doctor. Any changes in the nipple can be a cause for concern. This might include a nipple that suddenly becomes inverted, meaning it turns inward when it was previously outward. Also, look out for unusual discharge that's not breast milk, especially if it's blood-tinged or clear. These changes could be signs of cancer and should be checked immediately. Number 4. Sometimes changes in the skin of the breast can signal a problem. If the skin becomes red, irritated, or inflamed, it could be due to an infection or, in rarer cases, a type of breast cancer called inflammatory breast cancer. This type of cancer causes the skin to become red, swollen, and warm. If you notice any persistent redness or irritation, get it checked out right away. Number 5. Another sign that might go unnoticed is swelling in the armpit or neck area. Lymph nodes are responsible for filtering harmful substances, and cancer cells can sometimes spread to these nodes. If you notice any lumps or swelling in these areas, especially if they appear out of nowhere or feel hard and painless, you should see a doctor. Swelling could mean the cancer has spread, but it can also be a sign of other issues. Again, even though it may not always mean cancer, it's crucial to have any swelling checked by your healthcare provider. Number 6. Fatigue is common, but if you're feeling exhausted without explanation, it could be a sign of something more serious. Unexplained weight loss can also be a warning sign of breast cancer or other conditions. If you've been losing weight without trying or feel excessively fatigued despite adequate sleep, it's important to talk to a doctor. These symptoms might be caused by many factors, but if they're persistent, don't hesitate to get them checked out. If you notice any of these signs or symptoms, it's important to talk to your healthcare provider. Schedule regular breast exams and screenings, especially if you're over 40, and be proactive about your health. Thanks for watching today's video. If you found this video helpful, don't forget to like, subscribe, and share it with others.